Hey, East Central Illinois EMS, it's Dr. Bloomstern again coming to you with a quick treatment tip related to those patients with potential coronavirus. I'm going to be talking to you today about airway management techniques in these patients with suspected coronavirus or COVID-19. The goal in any airway treatment or oxygenation therapy is to try to limit aerosolization of the coronavirus. When somebody is in need of oxygen with potential COVID-19, the first step is to apply a nasal cannula. This is the preferred method of oxygen delivery. These patients, we still want to apply a simple surgical mask like this over the nasal cannula, over the patient, like so. If the patient is not getting enough oxygen with the nasal cannula, the next step would be a non-rebreather mask. You still apply this as you are taught, but you want to apply a surgical mask over the non-rebreather like this on the patient. I want to spend a quick minute talking about non-invasive positive pressure delivery of oxygen, such as CPAP and or BiPAP. Now, both of these have a high risk of aerosolization of the coronavirus and should be limited except in those patients with severe respiratory distress. Again, I want to emphasize that CPAP should be limited in those patients that are suspected of having coronavirus unless it is extremely necessary, as it has a high aerosolization rate of the coronavirus. While using either CPAP or BiPAP, it is recommended that you have a HEPA filter attached to the delivery device of your CPAP machine. If you do not have a HEPA filter for filtering out the coronavirus, it is advised that you try to avoid CPAP if at all possible. The step beyond non-invasive positive pressure ventilation would be endotracheal intubation. A quick word on endotracheal intubation in these patients with suspected coronavirus or COVID-19, again, is to try to limit intubation if at all, for the same reason as we talked about with CPAP. While intubating somebody with coronavirus or COVID-19, there is a great risk of viral transfer with aerosolization of coronavirus to the provider performing the procedure. If you must intubate the patient, it should be done only by video laryngoscopy. Blind insertion airway devices, such as the I-gel, are preferred over oral tracheal intubation in those patients suspected of having coronavirus or COVID-19 that are in need of an advanced airway. Again, let me reemphasize that if somebody is in need of intubation that is suspected of having coronavirus or COVID-19, we are recommending preferably the use of blind insertion airway devices such as the I-gel to secure their airway. Again, these are just a couple tidbits of information that will hopefully help keep you safe while you're caring for these patients with potential coronavirus COVID-19. For more additional tips and tricks, tune back in and we'll have more videos in the near future. In the meantime, this is Dr. Bloomstern with East Central Illinois EMS.